How to manage your baby crying. We all expect babies to cry in those first few weeks. However, some babies cry excessively, and studies show that excessive crying is actually linked to physical and mental health issues in parents, such as postpartum depression and anxiety. It can also increase the risk of abuse against the baby, called shaken baby syndrome. As a paediatrician, this is something I have seen in my career, and the underlying issue was that parents did not know how to cope with the crying or couldn't understand why their baby was crying so much. So how do you know if your baby is crying excessively, and what should you as parents do? In this video, I will discuss why babies cry, how much babies should cry, how to tell if your baby is crying excessively, and most importantly, the essential steps parents can take to manage and cope with a crying baby. I'm Dr. Gina, and over my 15 years career as a paediatrician, I have managed thousands of families navigate those tricky first few years. As a paediatrician, excessive crying is one of the most common issues parents come to seek advice about, and can be one of the most distressing. Dr. Gina is an evidence-based parenting platform that advises on common child health and parenting issues using current and up-to-date research, empowering parents to make evidence-based parenting decisions and choices. Make sure you hit the subscribe button and turn on notifications to get access to my weekly parenting videos. Firstly, why do babies cry? Human babies are fully dependent on their parents for feeding and caring and ensuring their survival. Crying and fussing alerts the mother that baby requires feeding, and it also stimulates the letdown reflex in mums who are breastfeeding. Babies should double their birth weight within the first 4 to 6 months, and they are completely dependent on their parents for this to happen. Crying is therefore a survival instinct for young infants. Babies cry for reasons other than just being hungry. Initially, it's their best way of communicating that something is wrong. It could be that they want comfort, they have a dirty diaper, or they're in pain. In the beginning, it can be hard to differentiate what the different cries mean, but as the weeks pass by and your confidence and experience grows, you will very quickly be able to differentiate between the different types of cries. Secondly, how much should babies cry? All babies are different. Some cry very little and others can cry for what seems like hours. Therefore, it's difficult to define normal. Initially, babies cry very little in the first few weeks as they're still in that sleepy phase. As they transition out of this, they will naturally start to cry more. On average, newborns cry for around 2 hours a day in total. Long stretches of crying can start from around 2 weeks of age and can last until they're around 3 to 4 months. Thirdly, what causes excessive crying? There are 3 reasons why your baby may be crying excessively. Firstly, a developmental phase. Most babies will have these periods where they unexpectedly start crying and may appear to be in pain. This tends to happen later on in the afternoon or evening and can in extreme cases last 5 hours or more a day. There is increasing evidence that this is a normal developmental phase, and many breastfeeding mammals also go through a similar phase. 2. It may be due to their immature gut. Crying may be associated with passing motions. This is called infant dyschezia. Often parents will describe episodes of their baby suddenly crying for periods of 20 to 30 minutes, going very red in the face, showing signs of pain and distress, followed by passing stools. The process of crying actually helps in enabling the baby to increase intra-abdominal pressure, which helps the stools to pass through the gut. It tends to peak at around 8 to 10 weeks of age and then gradually improves. It can be very distressing for parents as they feel their baby is in lots of pain. 3. Baby may be suffering with wind. Another reason for excessive crying is babies who have lots of wind. Like all of their organs, baby's digestive system is still maturing and is very responsive to excess wind or air. If baby has swallowed too much air, either through crying or feeding, it can stimulate the stretch receptors in the gut, which to the baby's brain is perceived as pain, causing them to cry. It can happen at any time of the day, but it usually happens later on in the day after several feeds. This also tends to peak at around 8 to 10 weeks and then will slowly resolve, but can take several months for some babies. Treating this is difficult as it is physiological and to do with the gut maturing, which is something that takes time. Some parents may resort to anti-colic medication to help resolve symptoms. There are no studies to date which show that they have any real effect in reducing the symptoms. Evidence does show, however, that gently massaging the abdomen and bringing up the legs in a circular motion can help. This enables the baby to release trapped air and wind, which can take away pressure off the stretch receptors and hence the pain settles. It is recommended to try this technique, and you may need to do it several times in the evening. Probiotics may also help. For colic. Colic is actually an umbrella term which describes babies who are crying for excessive periods of time. The actual cause of colic is unknown, but is more likely a combination of the normal developmental phase of crying, infant dyschezia, and gut digestive issues due to wind. The actual definition is the presence of excessive and inconsolable crying in an infant that is otherwise healthy and thriving. The crying should be for more than 3 hours a day, for at least 3 days a week, and for 1 week or more. 11% of babies have colic in the first 6 weeks of life, and this number reduces to 0.6% by 10 to 12 weeks. Once again, it is important to establish that baby is otherwise healthy and thriving and putting on an adequate amount of weight. All of the above causes of crying have the following features in common. Periodic crying. The crying comes and goes. Unexpectedly starts crying. They may be absolutely well and then they'll start crying for no reason at all. Baby may appear to be in pain. They may become red-faced, arch their back, bring up their legs and make grunting noises. Tends to occur in the afternoon or early evening, but it can be at any time of the day. It can last for hours. Baby is otherwise completely healthy and thriving. Whatever the cause is, it is very distressing, and if you are worried, you should have baby reviewed by a paediatrician. This is to ensure that baby is completely healthy and well, and there are other causes that may need to be ruled out, which can also present with excessive crying, such as an infection, a protein allergy, or reflux disease. There are several strategies that can help settle babies with excessive crying. You can try swaddling baby or placing them in a sling to help them feel safe and secure. Swaying or gently rocking baby can help. The constant rhythmic movement can help to settle them, or taking them for a walk in a pram or for a drive in a car. Holding them in a dark, quiet room to reduce outside stimulus, or using white noise if it's really noisy outside. Sitting or holding baby upright when feeding, as this can help to reduce them swallowing too much air during the feed. Try frequent burping to help release excess air. Try massaging their abdomen and bringing up their legs in a cyclical motion to help expel any of the excess air or wind they may have. Hearing our baby cry is very distressing. Our brains are hardwired to respond more intensely to the sounds of our baby's cries than how we respond to any other types of similar sounds. It also invokes a state of anxiety that we're perhaps doing something wrong, or something must be wrong with our baby. This anxiety is then sensed by baby, which makes it more unsettled, and the vicious cycle continues. Dealing with a crying and distressed baby can severely affect our mental and emotional health for both parents. Coping with a crying baby is overwhelming and can make you feel frustrated or even angry, which is understandable and a completely normal response. If you find yourself overwhelmed, then try the following. It's important to take time away from the baby, and even just 10 minutes away can help. Ask your partner or family member, if possible, to take over whilst you go outside for a walk or take a bath or have time to yourself. If you do not have anyone to help at home, then place baby in their cot and take 10 minutes to yourself in another room. If formula feeding or feeding via a bottle, such as express breast milk, ask someone else to give the next feed while you get a few hours of sleep. Alternatively, let dad look after baby at night time and only bring the baby to you for feeds. This will help you to get the essential rest that you need. Do ask for help from health professionals, such as your paediatrician. Crying can be incredibly difficult to deal with, but as babies become more familiar with the world and their gut matures, the crying will ease. By 10 weeks of age, the average baby cries for an hour a day, and by this time parents will be much more aware of and understand what their different cries mean and how to soothe them. Now you know why babies cry, use my tips to try and manage crying and be reassured that this phase will pass. I hope you found this video useful. To check out more videos, please subscribe, like and post a comment. Please visit my website to download your free parenting guide for 1 to 5-year-olds. If there's an interesting topic or something you would like to see covered in a video, please let me know. Thank you.